So let's make a huge applause to Alexandra. Alexandra made of the tight schedule to come here. Ta tuli väga lühikeseks ajaks meile, ta peab juba pärast lõunat ära lendama, nii et ta lendab põhimõtteliselt kohe siit minema, et kui teil on talle küsimusi, siis teeme hästi kiire küsimuste ringi. Ja Alexandral tuli välja ka just raamat mRNA tehnoloogiatest ja geeni interaktsioonidest. See on praegu küll prantsuskeelne, aga ta lubas, et see tuleb ka inglise keelde. Nii et let's say warm welcome to Dr. Alexandra Henrion-Caude and looking forward to your presentation. And we take the questions. If there are any questions, we take them after this talk, okay?
So, well, good morning, everyone. Thank you so much, Helen, for putting this great program. I am extremely honored and happy to be in Tallinn. It's my first time in Estonia, and so I hope I can come back another time on a more peaceful journey. But my journey at the moment is a bit. Sorry, I ruined your whole thing. So so my name is Alexandra Henrion-Caude. I'm a director of research in genetics, and have been tenured scientist and professor at the French NIH for 27 years, and I declare no conflict of interest. I insist on that because I even have a book that I released recently, but none of the money that I get from this book, I keep it for myself. I give it to people who have been suspended in France, so they lost their jobs for not being vaccinated, and they are not allowed to take another job. So it is a dramatic situation. So having no conflict of interest, close, far, no, nothing, I was very free to open my mouth and to get into troubles. And I dared share publicly my views on the origin of the virus, on the unscientific measures that we have undergone, especially the vaccines, the treatments, the common sense that was really threatened in regards to hygiene, the hygiene of the hands, the risk of the PCR test, the masks, and have been also promoting a lot of solidarity in France, even in demonstration, and in just giving hands to one another to reinstate the communication. And the book is actually doing a great job as well in terms of solidarity in the families, and people who have ceased talking to one another for the last 2 years start talking again together. And I think this is going in the right direction. As Jonathan says, we need to get out of our boxes, all of us. Où est-ce que voilà. So the title of my conference, for those who know me, they know that I am very moderate in using the words, and so I'm very precise with what I want to express, and so the title is very strong, and the reason it's very strong is because we are facing a horrible situation. So this is just, I believe, the largest scandal of the 21st century. With this massive use of mRNA technology. To whatever I say, I try to relate it to publication, scientific publication in our papers, and so therefore I used this publication in Nature Reviews in November 2022, where this woman from the R&D, alors attends, ça c'est pas bon. Here. Catherine Jensen was in charge of the R&D research and development of the vaccines in Pfizer, and she puts that title that I find just terrifying: COVID vaccines. We flew the aeroplane while we were still building it. If that is not terrifying to you, I don't know what will be terrifying to you. I've talked to pilots, and they said that they have been trying new aeroplanes themselves, but normally when they try an aeroplane, it is already built, and they are just beta testing it, and normally it goes wrong the first trials. So the largest scandal of the 21st century is really sad for us all. I took the number from Our World in Data. So we are reaching this terrible number of about 70% of the world population having received at least one dose of COVID vaccine. That means 13 billion doses have been administered globally. And that is to say that at the moment, this situation where we could rejoice somewhat because it looks, so this is the number of vaccination over since December 2020, and we are now in April 2023. We could rejoice, but yet this low number is still about 200,000 that are now administered each day. The good thing or bad thing is that 29% of people in low-income countries have received at least one dose. Good thing is that it's the minority. Bad thing is that it is still 29% of this population, and I believe that they will not be kept in peace, and that vaccine will come to them in a manner or another. So it's a good tendency, obviously, but our common aim should be to total freeze. The scandal that changed so many rules. Why do I say that? Is that I've discussed with epidemiologists, I've discussed with vaccinologists, I've discussed with pharmacists, with people involved in the regulation. None says that things are going the right way. And so this is why I said that they changed so many rules. One of the rules was that you never vaccinate a population in the trend of an epidemic. This is the first year of vaccination in Israel, in the United Kingdom, and in Emirates. What they could see is that, first of all, they started the injection in the peak of the epidemic. This was the number of COVID-19 confirmed COVID-19 deaths in Israel before vaccination. This is after vaccination. So some people had said, oh, it's about mRNA, but then you take another COVID vaccine. You go in the United Kingdom, where it was mostly AstraZeneca. This was before vaccination. This was after vaccination, the highest peak of COVID death. You take another countries, Emirates. You see the same thing that happens. Lower peak is here, highest peak after vaccination. Normally, in a normal world, I think that was enough to stop the vaccination at this stage, basically, or even before. So a few days after trying this vaccination. I want to dismantle a few words. One is pandemic, and the other one is vaccine. Why do I want to dismantle it? Because we have, we used to talk of pandemic thinking that there is a criteria of severity. And so the thing is that they had changed, when I said they, it's the World Health Organization that had changed the definition of pandemic. And so yes, indeed, in 1999, back in then, they used this idea that a pandemic would be declared under patterns of consistent disease, indicating serious morbidity and mortality in at least one segment of the population. One can, argue about this definition, but at least it was linked to the morbidity and mortality. The other changes, the changes that occurred along the path 2005, 2009, really rewrite the whole thing into phases. And I think this phase 4 just drops the whole idea of a pandemic. It says human-to-human transmission of an animal or human-animal virus able to sustain community-level outbreaks has been verified. This phase 4 was not verified. They pretended it was verified, but it was not verified. The whole thing goes on, and basically we are just into, the wording that lacks severity. So if now I have a pandemic of a flu, I can declare on and on this emergency status of our societies to say that, we need to go into any sort of measures. So the World Health Organization declared the COVID-19 pandemic as the justification to all this scandal, and they declared it in March 2020. So here I want to show you that this is a very peculiar orientation based on what we now know. Back in December 2019, the NIH revealed that you had the presence of SARS-CoV-2 antibodies in patients. So when they said that the pandemic was on in March 2020, again, according to their criteria once more, then why wouldn't they go to December 2019? Because in this winter of 2019, at least in the United States, you already had the presence in patients of the SARS-CoV-2. Now, let's move. France, November 2019, same. They identified antibodies in those French people and suggesting that SARS-CoV-2 infection may have occurred as early as November 2019. Italy, September 2019, they go and check for the presence in people who are suspected to have lung cancer. They take their blood retrospectively, and they realize that they had the presence of these SARS-CoV-2 antibodies once again. So let's move on. November 2019, a different method. They take wastewater, sewage, from human houses, and in this wastewater, they go and check for the presence of SARS-CoV-2 sequences. And there again, those results are consistent with the fact that SARS-CoV-2 was positive in November 2019. Have you heard of any crisis, terrible event ongoing in winter 2019? I haven't, and I guess you haven't. Brazil, November 2019, SARS-CoV-2 positivity of wastewater. Spain, March 12, 2019. We are now 1 year prior to this so-called pandemic declared by World Health Organization. They go and look at the samples of the wastewaters. What do they find? Again, traces of this SARS-CoV-2. Have they all died at that time? I don't recall. There have been a terrible drama in Barcelona back at that time. So you see how I want to share with you some of these different findings that are somewhat consistent with one another, that comes from different teams all over the world, and that show that basically this SARS-CoV-2 things was ongoing for the whole year of 2019 and in different countries, United States, Brazil, Europe. So the scandal, as I say, is occurring at many levels. This notion of pandemic should no longer be a justification for emergency, threat, or public health, since it now lacks the criteria of severity, and since you now know that they even lack precision, and they really, make their own story as they want. March 2019, we now know that some viral sequences were detected in wastewater. Autumn, winter 2019, is consistently we find in patients antibodies that were detected in humans. The underlying scandal behind this scandal is this definition of cases that were defined by a failing PCR design. The inappropriate treatments, with paracetamol, remdesivir, instead of using antibiotics, and the scandal for us all in our countries, for freedom, for science, and for humanity. So no one should have flown in this aeroplane while they were still building it. A not approved product, yet massively injected, as you see, billions of injection, using the misleading name of vaccine. Normally, a vaccine that would take the different vaccines that you see here, data from our world, the data and Nature. You have it takes like the measles. It took about 10 years to develop the measles vaccine. The SARS-CoV-2 vaccine. So yes, there is a problem. Why is there a problem? Because also they completely changed the definition of everything. So now the vaccine is a preparation that is used to stimulate the body's immune response against diseases, meaning that whatever you put into the body of someone that will trigger some reaction in terms of obviously antibody production, then that's a vaccine. I don't see it a good sign, but for them it's good. And they go on with the mode of administration. Vaccines are usually administered through needle injection, but some can be administered by mouth and sprayed into the nose. Vaccination is the act of is now, because again this definition has changed. It has become the act of introducing a vaccine into the body to produce protection from a specific disease. So the protection means really nothing. It doesn't mean that it will actually protect you from the disease. It doesn't mean that it will act against the disease. It just says that you will basically produce antibodies, whether these antibodies are facilitating or neutralizing. The largest scandal with massive use of an unknown product. This paper comes from September 2021 again in Nature, and they go through the history of mRNA vaccines. And they say hundreds of scientists had worked on mRNA vaccines for decades before the pandemic brought a breakthrough. This is true. The whole sentence is true. They forget to say one thing which is quite important, which is they had worked for decades and had systematically failed, never reaching their clinical trial beyond the phase 2 of their clinical trial. So this is quite some important details. So basically what I'm saying is that no mRNA had never been approved worldwide for any disease when they said the pandemic brought a breakthrough. So when declared in 2020, that was the situation. Like the others, COVID mRNA did not work, like all mRNA therapies. But in January in Davos, what says Stéphane Bancel, the CEO of Moderna? He goes and says, it's going to be okay. We have to go faster. 60 days, too long. We will go and have all the vaccines ready. Last week, at The Guardian, Moderna again, they hope that they will cover cancer, heart disease, and other conditions by 2030 with the advancements in mRNA technology. They don't care about the efficacy in treating, they just care about the advancement of technology or the speed at which they go. So upon my presentation of my book at the EU Parliament, I proposed to the medical doctors around the world, but in Europe at least, please sign a tribune saying, we have been lied. So this is the book, and I'm very glad and surprised because it is the first book It was released in March, and it is the best-selling book of year 2023, when this book of Prince Harry was released in January. This book, my book, was released in March, and yet it is already challenging Prince Harry. I really hope that I can move forward. It will be translated in all languages, and I'm very proud as well of that, because it gives a lot of information to the people in a simple manner. You can grab the fantastic thing that is your genetic, your genome to you, and understand that you have to be responsible for it and not to harm it in any manner. So it's a way of getting vaccinated without any vaccination. MDs, we have been lied to. Yes, you have been lied to. Take 2 doses and you'll be protected. This is a Lancet that shows that not only you're not protected, but that actually effectiveness of the vaccine is going negative. So it's worse. MDs told you mRNA will be quickly degraded. Really? Well, we see mRNA present up to 25 days, 15 days, 28 days, 2 months. We see it in the blood. We see it in germinal centers. We see it in the circulation, and even spike, we've seen it up to 12 months after injection. MDs told you mRNA will stay at the site of injection. Really? Well, that's not what we see in the literature. We can see the mRNA once more in germinal centers, in the brain, in the skin, in the heart, in the circulation, in the liver, in the milk from the mother, in the placenta, and we see the nanolipid particle that surround the mRNA in the ovaries, meaning that basically normally the mRNA is not staying at the site of injection. They lied. They told you the mRNA will not go in the nucleus of your cells. This is the very beautiful illustration showing the mRNA of spike within the nucleus, because it is actually translocated. They told you my mRNA cannot integrate into the genome. More and more data are accumulating, showing that on the contrary, we have all reasons to think that it has the possibility of, unfortunately, integrating your genome. The MDs did not tell you that the anticipated adverse effects from the official list was tremendous. This report from Pfizer listed 15,300 diseases. Did they tell you about that? Probably they forgot. This is not informed consent. And in this list, I was very triggered as a geneticist to see that the first disease is actually a deletion syndrome, meaning that, so I looked through their list, and I found 90 genetic diseases in this list. How can they reconcile a vaccine with genetic disorders? MDs did not tell you it may impact your mitochondria. MD did not tell you that it will impact your epigenetics, reviving some old sequences that you have in your genome, retroviral genes that you have. MD did not tell you you and your subsequent generation may be turned into human modified organisms. This is a sad thing, but we have to discuss it so that people understand. And so that we move forward our discussion into, first, halting immediately any sort of mRNA technology. Second, halting completely any mandate vaccination whatsoever is the vaccination, no mandate. And third, work on these poor ones that are altered. And I've said one thing at the minimum should be to systematically monitor the spike in vaccinated individuals. This has been done into a nice paper published in Circulation, where they detected the protein spike in the patients that have myocarditis. So in other words, these poor boys, average 16 years, had a spike in their blood when the control did not. So this is a good way that we should be asking for anyone, at least the young people, to have the dosage of the spike in vaccinated individuals. With that, I can tell you that I also want the pharmacists to go and have their own signing of their own tribune. Using my book, they have all the information on which they can say, we have been lied to. And if we convince all the pharmacists that we know or that we meet, the medical doctors that we know or that we meet, to sign something like that, then something can happen and will change. And I hope it can change so that we are not anymore in this garden of in this garden looking at the apple, looking at the Pfizer or Moderna apple, saying, well, I believe it can kill me, and it can really harm the subsequent generations. I had the last slide. I don't know if they put it. Did they? No, they did not. They did not. So I had my last slide was actually a very concerning one that shows that basically the excess mortality is increasing in all our countries, Israel, France, Germany, at a certain pace. But my worry is that you have a very peculiar curve taking place in Poland, I don't recall the countries that I've put in late. Hassan, the big link. Yeah, because it's something is happening in these countries that I don't know what's going on, and so there is a big surge in Hungary, Slovakia, Lithuania, Estonia, Croatia, and I don't understand what's going on and why did they have such an excess mortality as compared to the other countries where already the excess mortality was increased. This comes from Mortality Watch. You can actually do the search by yourself. Thank you very much. I don't know if I have time for questions. Do I? Yes? Okay, so any question I will be happy to take.
Yeah, we have time for the questions, couple of questions. Kas kellelgi on küsimusi? On küsimusi? Okei, väga hea. Ma toon sulle kohe mikrofoni sinna. Nii saame vist kõige rutem siit.
No question? Yeah. No question. Then action.
Thank you for the presentation. I would like to ask that you told that we should treat COVID by antibiotics.
Again?
It's echoing badly. This.
Yes, sorry. Can you repeat?
So you said that we should have treated COVID by antibiotics.
That could be one. Vitamin D was actually mentioned earlier. So the reason why I say antibiotics is because this is the way we used to treat any atypical pneumonia in the 2019 era, when the SARS-CoV-2 was ongoing and no one knew and everyone had a normal life. Then that's what they were doing. They were treating with antibiotics. Normally, if one antibiotic wouldn't work, they would give macrolide, such as azithromycin, and indeed, it has shown very nice results. So yeah, this was one possibility, but you also have heard about other drugs or other type of solution, whether natural or not natural.
Hello. Is there any difference between different vaccinations, like Moderna or Pfizer, or what was there?
Difference,
like results or like damages
different damages. Basically, the list of the injuries that was listed by the Brighton collaboration, so World Health Organization partner again, is consistent from one COVID-19 vaccine to the other COVID-19 vaccine. What I have the feeling, I didn't systematically search, but like Moderna and Pfizer, they're really consistent, but yet they always have a little difference in terms of being more prone or I don't know if they are more prone to give one aspect, but at least you will find more, let's say, myocarditis using one than the other. But the thing is that I don't know how much we can rely on this data because people have been vaccinated with, let's say, AstraZeneca, then Pfizer, then Moderna. So what can we say about that? Plus, there is this variation in the different vials. I thank you so much. This is my concern. See? This is, those are, the France, Israel, Germany. We have this excess mortality that we face, but I don't know what's going on in your countries here. And I'm concerned, very concerned. And I don't think that nobody mentioned that, or I don't know, but please put me in contact with whoever have noticed that.
Hello. I just wanted to comment to one of the questions here about antibiotics. Why do you use that to treat the virus infection? It's not to treat the virus infection, but virus infection will cause secondary infection by...
No, and azithromycin has, I know I've worked on this, has not only an antibacterial that has also an antiviral action, plus the antibacterial is that the secondary effect of whenever, this is actually very well described by Fauci early on. He had said that no pandemic, the Spanish flu, and they were not dying from the virus, they were dying from secondary infection from the bacteria. So whether the antibiotic has an antiviral action, such as azithromycin, that we know because we have used it in cystic fibrosis for some years, or antibacteria, you get the effect.
Yeah, and I think that's good also to protect against.
Yeah, because this is ultimately what you die from.
Yeah, that's good. But thank you.
Thank you.
Excuse me, I have also one question. I'm here. My name is Sergey.
I don't know where you are because I get this.
Right
you have to go like that.
Yes, I'm here.
I'm here. Hey.
Hello. Thank you very much for this very consistent and interesting material. I'm a medical doctor, so I have one question. Do we have any possibility to get rid of this mRNA while or after it is in our DNA, or after it's already in our muscles or various?
So the only, it's a very interesting question. The only possibility that I know that nature will get rid of an mRNA that it doesn't want is pretty much the cells themselves, the nature that will, have this little bulb of that we call some kind of exosomes that will get the mRNA out. It can be for regulation purpose, but it can as well be to get rid of the mRNA. I don't know any other possibilities to get rid of this mRNA. Even the degradation, if it occurs, because for the moment what we see is that it is extremely stable once it is. It can either already be degraded, but I guess it's not degraded. It's from the synthesis, because some are longer, some are shorter. So, but we don't know. The thing is that we know how to get rid of is more the spike, the circulating spike. There are very nice paper stating the interest of bromelain and the combination of bromelain and N-acetylcysteine. I am not fond of those papers about nattokinase because the nattokinase will strip as well the receptors such as ACE2. So it seems to me a bit aggressive. So, you know, so we can, I guess, address the question of the spike. I don't know at this stage that we can never address the idea of getting rid of an mRNA in your cells.
Thank you very much.
On veel küsimusi? Sul on seal, jah? Kaks lausa.
Salut Alexandra.
Ah, Jérémy, je t'ai envoyé un message.
Yeah. I received your message, yeah. Thanks.
I said, if you're around here, because of the French connection, you know, it's like, it ought to be.
Okay, so my question was, do you see a difference on the side effects from mRNA vaccines compared to normal vaccines from Johnson and the others?
So that comes back to the second question that the lady asked, and you saw the curve from these different countries: United Kingdom, AstraZeneca, Israel, Pfizer. And basically you observe about the same type of curve. So in terms of death, I would say that unfortunately we did not, we were not in the capacity of assessing any difference, not that I know of. It's probably, as I said, some different susceptibility, and so that really links it to the spike protein, because that's what they have in common. The other thing that they have in common is to be a vaccine, so just to put into the circulation some amount of liquid.
So it's basically vaccination in general that should be criticized more than just mRNA vaccines, right?
Yeah, the reason why I'm talking more on mRNA is because I've been working specifically on RNA, so I knew perfectly that the mRNA technology was not mature at all, that it was a failure. And so when I see that they go on, you know, with using this mRNA technology for any diseases, like they say, for 20 to 30, I say we need to halt. And that's why I put all the focus on mRNA, because they don't talk about the other vaccination or little. They do, but little. But the real focus is on mRNA. And they develop an industrial process in different countries, so to have it locally prepared. So it's a huge industry that is being built, unfortunately.
Okay, merci Alexandra.
Merci, à toi. My personal opinion is that when you change a word such as pandemic and withdraw any connotation of severity to that word, then yes, you are not in a health concern. So yeah, I mean, that's why I insisted into sharing this information about, you know, having this SARS-CoV-2 around, these antibodies around for whole year before, because they knew. The NIH, it's a study from the NIH that I first showed in December 2019, meaning that they knew. So why suddenly they would need, you know, a whole bunch of solutions such as vaccines and, you know. So no, yes, it is a big business, and if you get to read my book in English or in French, you will see that I go in, you know, saying all the disaster that these big pharma have put with a number of drugs in the past, and my concern is that each time they have been caught by the justice, they had to pay fine, but they really care little, because they are always judged after the thing happened. So now, with my presentation, with this information, I believe we can confront them at present, in real time. That's what I wish.
Thank you very much, Alexandra. And aitäh kõigile küsijatele, nüüd on meie aeg läbi saanud. Üks küsimus on veel, nii, palun.
I will stand up and salute you. Because you're a doctor with a big letter D.
Thank you, sir. Thank you very much,
You're a
sir.
freedom fighter as I am. And I love you for that.
Thank you.
You're a great light in France. Keep that light.
Thank you.
And I know
I
will win this fight, and we will leave all these lies, all this darkness behind our backs, and we will create a much better world for everyone for all the humanity in this world, and this will make happen if we will all do it.
aitäh sulle.
That's a word of conclusion. Thank you. What I can tell you is that despite the fact I get tremendously attacked, when I say tremendously is nothing as compared to what you imagine my life is. And I'm here in front of you, so happy to be straight, not to fear any question that can come to me, because I know what I am, what I've been trying to do for my whole life. And therefore, I believe, like you, that so many people are connected with their hearts. They know we can fight together to what we think is unfair and what we think should be halted immediately. I need the MDs on board. I need the pharmacists on board. You need to sign something. We have been lied to. We have been lied to. Thank you.
Thank you very much, Alexandra. And I also fell in love with her in Stockholm in January. And I'm so happy to have you here. Thank you very, very much.